So hello, my name's Jackie Mackay. I'm an ambulance paramedic here at Broome Sub-Centre. I've been in the job for about 30 years now. As an ambulance paramedic here in Broome, we work alongside volunteers. In Perth metropolitan area, they tend to work with other qualified ambulance officers who are training to become paramedics. And that's part of the job flow to become a paramedic. Day to day, we would start by coming into the station, usually a little bit early. We need to get our drug pouch out of the safe, check the drugs, that they all balance. We need to check the ambulance, make sure that everything's charged up, that it's still fully stocked. Even though we tend to do that after every job, you never know, the last crew may have used something in the ambulance. We need to check out-of-date drugs, out-of-date equipment, all of that sort of stuff. We need to start up the truck, make sure it works and make sure it runs, and check the fuel level. After we've checked the truck, we'll often go back inside, answer some emails, have a chat to the person that I'm working with that day. When we get a call from the community, we get a loud alarm going off within the centre, and it tells us it's either a priority 1, 2 or 3. A 1 means lights and sirens, so we have to leave immediately. We'll go out and do the call, take the patient to hospital and clean up the truck afterwards and then come back. Most of the time patients do go to hospital. Sometimes we get called to people who just need a hand up off the floor. A little old Nana's fallen over and she just needs a lift to get back up off the floor. Those sorts of things can sometimes happen. We also do a lot of RFDS transfers up here because there's a lot of people coming in from communities all around the Kimberley, and even the Pilbara people will come up here to Broome. So we need to get them from the airport into the hospital. So we do a lot of those transfers as well. My jobs on a day-to-day basis can range from, yes, a very simple RFDS transfer to a cardiac arrest, to someone having a baby, to someone who's fallen over and broken their leg, to a kid who's fallen out of a tree, and everything else in between. And that's one of the things I really love about my job. It's very different every single day, and it just makes coming to work an adventure. Baby, to someone who's fallen over and broken their leg, to a kid who's fallen out of a tree, and everything else in between. And that's one of the things I really love about my job. It's very different every single day, and it just makes coming to work an adventure. So in order to become an ambulance paramedic, it's now a university degree. So you do need to do Year 12 ATAR. It's available at ECU. That's not through St John Ambulance. So there's two methods of doing it. You can apply to ECU and do it through ECU, or you can apply to St John for a position within St John, and then they've got a special school that goes through Curtin University. That's not to say that if you do the course at Edith Cowan, you won't get a spot with St John once you're qualified. That happens a lot. And once you've got your ambulance degree, you can then go on and work at other services around Australia. We're now a registered profession, so our ticket enables us to work all around Australia. In order to get a job with St John Ambulance, you do need to be over 21 if you're going to go down a career path of becoming an ambulance paramedic. So they like people with a little bit of life experience. So often it works if you'd like to go out and just work in the community for a couple of years. Some people start down a nursing career path in nursing in uni because you can start nursing straight away. Not a bad way of doing it because you do then get some credits for your subjects. You do 1 year full-time uni. When you're doing it with St John, you do 1 year full-time uni, and then you come on the road and you'll be working alongside a paramedic such as myself or the other paramedics within the depot. This is down in Perth. And you'll be effectively the junior officer, but you're still hands-on. You're treating patients, you're assessing them, you're administering medications, doing everything that a paramedic does, but under a paramedic's supervision. Here in Broome, we actually don't have that availability to have student ambulance officers here. So you have to go to Perth in order to become a paramedic at this stage.